plan in terms of her going back to Colorado? I don't follow you. She was supposed to call as soon as she got out there. Defendant's counsel, objection. It is leading and suggestive. The court overruled. I wanted her to call me when she got out to the state, and we had a list of board-certified surgeons in the United States, and I was going to get in touch with one of the surgeons there who was board-certified and have him or her follow Kate while she was at Ohio State. Now, during the direct examination, Ms. Ott asked you questions about telephone calls on the 24th. Let's go over that note now. Okay. She asked you whether Kate had called. Do you remember those questions? Somewhat. You do remember them? Somewhat. Doctor, after the 16th, did you keep in contact with Dr. Berg? Yes. Did you also keep in contact with Kate? Yes, I did. And the purpose of keeping in contact with Kate was what? Defendant's counsel, I object. Calling for the operation of the mind. The court overruled. Well, if she's my patient, I was very upset and concerned about this complication, and she was going to be in college anyway, but I still wanted to maintain some sort of understanding about what was going on. And then, when she would be back east, I wanted to see her at the office as well, but I wanted to make sure she had a proper continuity of care by somebody that would really be adept at treating these soft tissue problems. Defendant's counsel, move to strike. The witness is wandering all over the lot. The court overruled. Motion denied. Did she come back to your office after the 16th of September? Yes, she did. And did you see her in the office on the next time, which would have been October 11th? Yes. At that time, you describe in your note your findings and the treatment. At that point in time, with regard to most of the incision, what do you say about that? Do you mean in this note? Yes. Most of it looks reasonably healthy now. I would think that it's going to start to contract in and close fairly well. Basically, it is a separation between the skin of the flap and the remaining healthy tissue of the skin. This should close, but at this time it is probably going to take about 3 months. I went over the options at a later date with Kate and her mother. I will see her back when she returns over Thanksgiving vacation. Defendant's counsel, Your Honor, I just object that he's reading not all of the note, but skipped quite a bit, the first couple of sentences anyway. The court, then you can do that on redirect. Plaintiff's counsel, she read them already on direct, Your Honor. I'm completing that note. The court, listen, if she wants to read them again on redirect, it's all right. Next question. With regard to the options, did you know what it would entail at this point? Well, at this point, it had not closed, and I didn't see what the outcome of it looked like, so it was premature. I just wanted to let the patient's family know that there is a good possibility that some further work may have to be necessary in order to improve the appearance, but at a later date, and certainly at an unspecified date, because the wound was still healing at this point. Now, the next time you saw her was Thanksgiving holiday at North Shore? Yes. Why did you see her at North Shore? Well, it was over Thanksgiving holiday. Defendant's counsel, objection, Your Honor. The court overruled. The office was closed, and I wanted to see her if there was any debridement to be done in a place where I would have the materials available to do that. And North Shore was sort of a little closer for them, so we met in the emergency room, the waiting room. Then we went up to a minor, it's called a minor operating room. Was she admitted to the hospital that time? No, I just wanted to use the hospital facility if I had to do any debridement. Did you examine her at that time? Yes, I did. Was there any treatment necessary? No. By that time, she had actually healed. I had anticipated it would take a lot longer, but actually the wound, once it granulated, it closed quite quickly. Now, after it had healed, did you see withdrawn? Did you see her again after that? Defendant's counsel, objection on the ground of relevancy. The court, objection overruled. Yes. And when was the next time? That was December 30th, 1991. And would you read the first part of your December 30th note we've read, and that pertains to the North Shore contact? Yes. Let's go to the second part. What did you find that day? Today, I see her. Everything is healed reasonably well. The right areolar area, however, is quite abnormal looking with scarring in the superior two-thirds. This is going to have to be revised for a better appearance. Let's stop there. Did you tell her that? Yes. Continue. There is also some widening of the scar along the mammary line, lateral to the vertical line. This should soften up and lighten in color and probably not be a problem, however. Doctor, with regard to that very first contact you had with her back on March 27th, 1989, when we talk about widening of the scar as a note, is that what this refers to? Yes, it is. Okay, now continue. There is still quite a bit of this scarring in what is probably the pedicle beneath and behind the areolar area. I will see her back in June when she has completed her semester at school, so we can sit down and discuss an approach for treatment at that time. So at that point in time, had you finalized exactly how she would be treated? Defense counsel, I object, Your Honor. The court, objection sustained. Why did you wait? It takes a long time for scars to heal. Not only do the scars have to soften, but with time, as time goes by, the scars will also relax, soften, and you'll get an increased blood supply. If you're anticipating putting a skin graft on an area where there is a lot of scar, you really should wait probably a minimum of 9 to 12 months to allow the scar to soften and for maximal vascular growth, so that any graft that you put there in the future has a maximum chance of survival.
Dream of California.